Andre Glendis. Very nice to meet you. Dr. Bob Murray, Chief Medical Officer for NextGen. Thank you for giving us some time this afternoon. All right, so we'll start off easy. If you don't mind, I'll have you both just introduce yourselves, tell me where you're from, and then one of the other of you needs to tell me a little bit about Cherry Health. So,
Yeah, I can start. Glenda Williams. I'm the Chief Information Officer for Cherry Health, Grand Rapids, Michigan. We are a federally qualified health center. We provide comprehensive medical, behavioral health, dental, vision, OB-GYN, and a host of other services, including a prisoner reentry program. Been with the organization for almost 12 years now. Andre, I'll let you intro yourself.
All right. My name is Andre Beaumont, and I'm the project director in the IT department at Cherry Health. And I've been with Cherry Health for about 13 years now, and have been engaged in a number of projects with NextGen.
awesome. Thank you both. All right, so if we can, let's start with your entry to the Excellence in Healthcare contest. So maybe explain kind of what problem you were trying to solve, or what outcome were you trying to achieve, and then what you did.
Sure. One of the main areas that we were having trouble with was coming up with a uniform method that people could use to perform their duties for preparing for that visit. By going through the different aspects of the chart, following up on third-party details, looking through everything that's needed from that's still an outstanding item for a patient and in preparation for the visit. And one of the challenges there is that there are a lot of variations depending on the specialty that we're working with, and the location, and all of the variations in there with chronic conditions and other things that need to be considered to really prepare for that visit before the patient arrives. And so what we did is we developed a template that allowed us to really key in on some of the main tasks that need to be done prior to that patient showing up. And this we call the chart prep template, and it's available on our patient information bar. It's easy to access. And we made it available for all of our specialties and all of those different situations so that they can get to it very quickly. And what it does is it allows them to go through a setup list that allows them to enter in a status on each of these items that need attention, or maybe it just needs to be acknowledged that it was reviewed and it's up to date. But it allows us to create that before the patient shows up and generate a custom document that shows the provider that all of these things have been looked at and checked, before the patient gets there. And what we found with that is that it really does add to the sense of completion before that patient even arrives, and that sense of understanding of all of the components that were looked at, before that patient's right there in front of the provider. Yeah.
But let me make sure I understand. So you built this with template editor. It's just a regular template. And so, but the idea is that depending on the specialty, or maybe what chronic conditions the patient has and their other demographics, you kind of like have a chart prep, a pre-visit planning process that is the clinical routine, and that this allows people to mark things that have been done. And that way the provider feels confident that, that things were looked at or whatnot. Does the template itself actually, they don't just market it, like tell me about some of these types of items. You mentioned them briefly, but what types of things are you doing?
Yeah, some of these items might include verifying their immunization record with the state. It could include reviewing past outstanding clinical quality measures that relate to the patient that need attention. It could be reviewing past orders or referrals that are still open. It really is designed for someone to be notified that this has to happen. Now with template editor, that's allowed us to build in some of the additional features that that come along with a lot of different NextGen templates. We were able to build in a tasking component. So if someone does see something that requires attention, they can actually create a task right from that template and send it to an individual to follow up on, either before the visit or as part of that visit when the patient's with us. So it really kind of acts as that first check over everything. And then for the provider, having that document, they know what they're walking into, right? So they know that, okay, there's still a couple items that maybe are outstanding, or there's some additional tasks that were sent to my nurse from whoever did the chart prep, so that we know this is being followed up on. And that was really something that because we have those template editing tools available to us, it really enhances our abilities to meet those needs too. And we did take it a little bit, one of the other challenges with this is that you're going to have changes made to some type of clinical process like this, right? And that's going to just shift and change over time. So one of the things that we also built into this was the ability to have a template that allows us to configure this template that's used for chart prep. And we did that through the ability of making like a system template that allows us to add tasks to that standard list, or add due dates and other statuses and things like that, so that if a business leader comes to us and says, hey, we need this other item added to this, we don't have to go back to a developer. We can just come out and open up that configuration template, quickly make that change and move on. And that's another feature that for us is really important, is our ability to create these templates and expand them, and also build them in a way that doesn't lock us into just reprogramming every time we need a change. That really helps us keep these things versatile and agile for our different needs.
Terrific. And so I think you said this, but let's say that the person who's reviewing the chart finds the clinical quality measure that needs attention. The patient is due for an immunization, or they need a mammogram, or whatever. Explain, so they can task, you said that, and then
Yep.
maybe that also shows up on the document. And is the document, is that a piece of paper, or is it a document that the care team typically views in the computer?
Yeah, the document will save directly into the chart. And we have that file into the categories so that people do know where to go see that information, when they're getting ready for the encounter that's coming. And so we don't necessarily generate that as a printed piece of paper, but we do have it go directly into the chart so that it can be easily viewed by anybody to know what was done in the prep process.
Got it. And if it says they're due for a mammogram or due for an immunization, that's, up top somewhere or whatever, trying to call attention to it.
Yeah, exactly. And then the provider is going to know that this is something that they're going to have to, address with the patient while they're there, and take care of that.
Or the other clinical staff. So we have a
Right.
lot of standing orders as well, right? So if it's a diabetic patient who's due for their A1C, it's been identified already, and that MA is going to plan then when she's rooming that patient to get the A1C because they're standing orders.
Yeah, absolutely. Yeah, pre-visit planning is key to clinical quality measure success, as is take as much out of the hand of the provider as you possibly can.
Exactly.
Care all about
At the time that this tool was created, we were having a few issues with accountability. So the fact that we can go in and have those statuses checked was just another accountability tool for us to use to make sure that staff were, one, doing the work, but then two, generating something that they could use in huddles. So when they were doing their morning huddles and talking about the entire day, then that was one of the documents that they would look at as a team.
Oh, that's great, because they just in the morning huddle, they just pull open the patients and just take a look at the planning documents, the chart prep documents. And then when you say accountability, I'm curious to know a little bit more, because for me as a provider, I frequently am working with the same care team. I frequently have the same nurse, and our care team is pretty stable. That's just for me personally. Other providers at our practice, they're a little bit more fluid, and so I've definitely heard them say, I'm not sure if the MA did this, or my one MA does it this way, but my other MA does it this way. It sounds like this kind of helps standardize that. Is that some of the accountability that you were mentioning?
Correct. We definitely don't have a handle on stable staffing models. There's a lot of turnover in our FQHC world. So this is a process that helps guide whether or not, you're rooming for Dr. Murray or for Dr. Andre. You've got your process that is standard, and part of that is to go through and do this balance check on patients.
Got it. And so it sounds like the MA actually, checks a box or somehow indicates, yes, I did this, and then that's part of the accountability part, right?
Yes.
Yeah. Awesome.
Yeah, and I'll just kind of add to that with the dynamic setup that we have. We have been able to use this to address some of the other things that might just kind of come up as people say, "Hey, by the way, we're having trouble with getting this done before the patient shows up." And just an example of that, we've been able to add an item specifically to address things like whether or not we've got somebody that's made sure that we've got all of the hospital records received for the patient.
Mhm.
And we can really kind of add these things as needed, which is really helpful. A lot of times these types of things are trends that people start to notice over time. Like all of a sudden, we know that most of our staff are having trouble getting a certain record type or something like that. We can build that into this and know that we have a tool already in place that people are used to seeing and used to using, that
Mhm.
then just calls those new things to attention, but not in some new way that requires a lot of retraining, just in a new commentary that goes along with that. And that really helps just stay up to date with trends like that.
Yeah. No, that's great. Once you have the process in place and people are used to it, you're just, refining it over time. So it sounds like that the kind of the to-do list for a given patient also varies based on, specialty and maybe what conditions they have. So what kind of, when you're building the rules on the configuration template, what kinds of scenarios can it recognize and then trigger rules or trigger to do items based on?
Well, one of the things that we built into it as well pulls in the information that providers have entered into past assessment and plan notes
Hmm.
into those templates. It also pulls in some comments that have been entered into our triage telephone call templates as well. And a lot of this is able to serve as kind of a central point to just help with the history of what the patient is here for, and so being able to comb through that, it not only gives a view for what's coming up here, but it also kind of goes back and for some patients that see multiple providers at our practice for different services and different reasons, it ties all of that together in a very condensed way, which really can help for that cross specialty kind of communication that often needs to happen for the patient's treatment. And so that's something that we built into it. It's not directly triggered necessarily off of a specialty in this case, but
Hmm.
it does condense things in a way that I think is very helpful for reviewing that history quickly, and making adjustments for it. Where it comes into being able to trigger off of specialty and come up with some of these special items related to those things, really comes into the way it can take that take that upcoming appointment information and display that too. So what we can do there is we can drive certain things that, if this is a visit at a certain location where we know that there's a program that only that may only provide services at a specific location, we're able to trigger off of that to say, okay, this patient is part of this program, and therefore we want to add this additional checklist item that's related to that program.
Got it.
That makes
And
sense. Yeah.
for the plan and for the information from the phone calls, is that more useful for the person that's doing the chart prep, or more useful for the day of care team, or both?
I think the feedback we've gotten here is that it's useful for both situations. So a lot of times when people are doing that preparation the day before, being able to see that past encounter information quickly without having to go all the way back through the chart for past encounters, a lot of times that's enough information to help them to follow up on some of these items before the patient arrives. And then from the care team's perspective, they can utilize this to have that view quickly and easily. Now, there's a lot of other ways that they access information like this, but this is a place where it really is in kind of one spot that
Sure,
can easily be viewed.
Do you have a good idea about how long, on average, it might take a person to do chart prep for a
I
patient?
don't. No, I don't have a good measure on that.
It's usually a few minutes per patient. They're not spending 10 or 15 minutes. It's usually maybe 3.
Wow. Okay. And
Maybe
is it
max.
the same clinical care team that is seeing patients? Is it a different group of people? Who actually does it beforehand?
It's the team who's going to be seeing the patients the next day. So they do it in between patients or during like no-show times.
Got
So
it.
that's kind of their workflow. As if we have I was at MQHC, I think our average no-show rate is about 20%.
Yeah. Well, that's actually not
So,
bad for an FQHC, but yes. So,
so during our quote downtime, that's when
yeah.
they're doing some of this work.
And it sounds like you answered my next question, which is how far in advance do you do it? It sounds like it's the day before.
Correct. Anything further out than that, it's really easy to forget.
Mhm.
So as you're refreshing yourself for who's coming in tomorrow,
Yeah.
you've just done that work. So you're like, oh yeah, I remember looking at this patient yesterday. They just got out the hospital.
That's
It's more of a oh yeah refresher. If you're doing it like a week out or 3 days out, I don't think the tool will be as useful.
That's a good twist. Yeah, a lot of organizations, when they're doing pre-visit planning, it's a different group of people that's doing it. And so what you're alluding to, like remembering that you had just looked at all this chart and that being a time saver on the day of, is a great twist on this. All right, this question might be sounding off the wall, but folks that are kind of new with NextGen or new with template editor, they hear all kinds of warnings that you have to be careful with upgrades, that the customizations and can cause headaches and everything. So has that played into this at all, or is that a concern when you're doing this type of customization?
At one time, it was a concern, and we've been with NextGen for years now. And over time, with our upgrades, we've consistently been able to improve on our ability to move things forward into the new versions of NextGen. Part of that does require some thought on how you're planning stuff like this and how you build that. So we've had a lot of lessons learned on it over the years, and a lot of it comes down to really understanding when you're developing templates like this, that you're developing them really in a lot of ways from scratch. And the more that you can control the basis of what you're building with template editor, rather than just modifying existing templates from NextGen, the more you can build your own from the ground up, the much easier that process is going to be. And what we found is that for the most part, even when we're interacting with the NextGen content directly, if we've built the template ourselves, really maintaining the connections into the other templates, with that connectivity, it still survives upgrades usually. Really, for the most part, NextGen has done, I think, a lot to make that a little bit simpler for us in that every single upgrade that we take, even though there's always customizations that we're going to have to rebuild into the new version, the underlying structure that our custom built templates interact with has been pretty stable over the years. And so if we're making something that has a data grid or displays information about allergies for a patient, it usually doesn't take any kind of rework to know that when we upgrade, it's still going to be the allergy data, and the data source for that information is going to stay the same. Where we have trouble is where we try to go too deep into changing NextGen's content in our system. And that's really one of the pitfalls to kind of watch out for, I think. But adding your own templates into NextGen has been really, that is something that for us, that's a key part of what keeps NextGen as our go-to system and software for this. We have a lot of different needs as an FQHC for grants and all kinds of type of programs that we have that are unique to Cherry Health and unique to the state of Michigan, or unique to, in some cases, payers that we interact with. And having our ability to build that within the software and know that we've got the tools to do that available to us, that really helps NextGen stand out for us, and it keeps us being able to react and develop new ways to meet those needs when they arrive.
All right, just in the last couple of minutes, I want to be respectful of time. So if there may be clients out there that are interested in kind of starting some kind of chart prep, some kind of pre-visit planning process. So they're obviously not going to jump right into, you know, what you've been developing over years, but what advice do you have for them? Where should they start? Who do they involve? Like how should they get going?
I think for us, where we found success was starting with the provider leadership and understanding where the pain points are for when the patient arrives into their visits, and really understanding what needs to happen for that to be the most effective interaction, and really working backward from that, I think is really one of the best approaches. If you think about what happens when you've got the patient really right there in front of you, and all of the work that has to go in to make that the most effective interaction, both for the provider and the patient, pretty soon people start making a list. It doesn't take a lot of work, I don't think, to draw that out from people. You know, right away, you're going to find things like people saying, well, this is never done, and I never know this, you know, when a patient arrives. And if I only knew this, it would make this much easier, right? So really kind of working that list and working with the people that are interacting directly with the patient, and finding where the common patterns are in that. And then I'll just kind of add to that is make sure that you've got something built into the concept that this is going to change and it's going to shift, and be ready for that. You know, having a universal process is really, really important, but also having a universal method to change that process is almost equally as important, right? So, you know, so when these trends come and go with what needs to be done before that visit, when those things change, you've got a method to jump right in and say, okay, we all know what to do, and we all know what to do when it changes. Those parts are really important, whether it's done with a template or just documentation that people follow. I think that's kind of key to just having a solid process to begin with.
Okay, well, this was terrific. Thank you so much for your time, and we'll put it all together. We're going to put it on the new Better Outcomes space in Success community. Have a great rest of your day. Thank you so much.
Thank
Yeah,
you.
thank you.